Okay, so today is the first day of Module 154, and we're doing anesthesia. So one of the problems that I've had in the past is having students get very, very hung up on the base, time, unit, that formula. I want to give you a little tiddly bit. The only time you have to figure that out is when you do that exercise in your book. It's not on your NCCT. It will not be on your chapter quiz. It will not be on your final quiz. So I don't want you to stress out over that. If you become an anesthesia coder, they're going to teach you their way. Okay? Hi, Jada.
Hi, good morning.
Good
I
morning.
just got to talk with Kristen.
Yeah, she told me.
Jada's best friend joined class. And I had no idea, so I did a welcome video with her a while ago. And I had put her on a study team, and it was like Sonia, Jada, Miss Roblin, Miss Rhonda, and she was like, Jada's my best friend. And I was like, I didn't even know that, and I put you on her team. Yay! So she was very sweet. I enjoyed talking with her. So, okay, so you guys understand, do not fret and stress over the anesthesia formula. Everybody understands that. Please do not stress over that. There's other things you can stress over, but not really in anesthesia because you guys are gonna enjoy it. It's very simple. Okay, so I'm gonna start out a little different today. The reason I have my webcam over here is because I'm actually going to turn it down to my CPT manual. So if you don't have your CPT manual handy, please get it. Well, sorry, operator troubles. I think I'm going to have to order some other type of webcam holder because this is called a gooseneck, and I can never get it right exactly where I want it. Okay, so have you guys taken off your tab from your tabs page and put it on anesthesia yet?
Yes, ma'am.
Okay, if you have not, you need to get. Hi, Miss Roblin. So good to see you. Okay, so I have put my anesthesia sticker on already, and I just put it in the first page of my codes. That's the way I like to do it. You do not have to do it that way. Anesthesia is broken down into anatomic sites, which means parts of the body, right? So I just want to point out that this starts in our green on page 71, and it's going to start out our guidelines, but it also does a breakdown of the head, the neck, thorax, and thoracic, spine, and spinal cord. You see that list there? That is a great resource you can use if you don't label, but you don't have to do it my way, but you know what I mean? You can turn to there to see, because if you don't have to use your index and you just know where to go, have y'all found that to be quicker? If you don't have to look it up in the index and you can just go straight to where you need, it goes very fast, doesn't it?
Yes.
Okay. All right. So I'm opening up to my anesthesia guidelines on page 72, and I'm going to make a point. It says time reporting. So when does anesthesia actually click in? When does the anesthesiologist actually begin to start billing? Well, anesthesia time begins when the anesthesiologist begins to prepare the patient for the induction of anesthesia in the operating room or in an equivalent area, and ends when the anesthesiologist is no longer in personal attendance. That is when the patient may be safely placed under post-operative supervision. Now, I have had procedures done where there was no anesthesiologist and the doctor did the anesthesia. I've had procedures where I had an anesthesiologist with me. As soon as they gave me the relax me medicine, all the way up until the time it was time to go out of the surgery. So, you know, every situation, every person is going to be a little bit different, right? Okay, so I'm moving over to page 73. Do you see those physical status modifiers?
Yes.
Do we understand what those are? We know what modifiers are. They just give more information to the third-party payer, right?
Right.
These modifiers are a little bit different. So I want you to look the back cover. Okay, I've opened. Where are your modifiers in your manual? These are the first 6 modifiers on the right-hand column, and it's under anesthesia, physical status modifiers. So you have them there. You have them in, I think they're in your Hicks picks. And you also have them here. Okay. These 6 levels are consistent with the ASA ranking of patient physical status. Physical status is included in the CPT code book to distinguish among various levels of complexity of the anesthesia service. Okay. Not only do you have that, you have qualifying circumstances, 73, and it's on the opposite side of the page as the modifiers. Okay, you see the plus signs in front of those numbers? What are those codes called?
Add-on.
They're add-on codes. You have to add them on to something to make them usable. So these are the add-on codes. So I'm just going to read 99100. Anesthesia for patient of extreme age, younger than 1 and older than 70. So if you have a scenario and the patient's 75, or you have a scenario and the patient's 6 months, you should automatically remember that's a special circumstance. And you can see, I don't know if you can see very well, but I have labeled older than 70, but then I also went in and highlighted. 99116, if a patient has to be put in total body hypothermia, that's a rare thing. That's not something that happens very often. But if you have a scenario that has hypothermia in it, remember physical status, qualifying circumstance. Then 99135, controlled hypertension. 99140, emergency conditions. And then it gives you a definitions of what emergency is. An emergency is defined as existing when delay in treatment of the patient would lead to a significant increase in the threat of life or body part. So an emergency can be a threat of life. I mean, I'm sorry, I'm not going to say it's always a threat of life, because sometimes I feel like it's an emergency irregardless. But these are what qualifying circumstances are. Now, as you start coding your scenarios in your workbook and your review, you're going to be able to see or recognize when you're going to need a qualifying circumstance. And when we do Zoom class on Thursday, we will be doing coding class. All right, now I'm going to open up and show you. My anesthesia tab is here, and then if I lift it up, you can see that I have 2 purple ones and 2 purple ones on this page. And I used big ones because there was more than one thing on each page. So I know this is my head and neck, thorax, and intrathoracic. Then if I turn, I have my spine and spinal cord, upper and lowercase abdomen. Then when I get here, I've labeled all across the side, pelvis, upper leg. Okay, just one second, guys. Let me, we have a student trying to join and she's having trouble. So let's pause for one moment. And so I can give her send her an invitation. Hang on. Gotta pull out the massive book that has everybody's name and email addresses in it. Okay, let me see. That is not what I wanted to do. Oh, there we go, invite. Okay, so ecook40516 @gmail. Okay, thank y'all for being patient. Okay. All right, there we go. All right, so I just went ahead and used small ones for this because I wanted to show you the different sizes, and they can be, either ones can be used. And then here I just did bigger ones again. Now, let me tell you why I think it's important to do this. Because if you have a scenario and they're doing some sort of a brain surgery, or they're doing something to do with the head, where would you go to in anesthesia? Under head.
Head.
The head. Good morning, Erin. Erin, can you hear us? Erin? Erin, you can hear us now? Okay, good. We're actually in our CPT manuals, and we're looking at our anesthesia portion. Starts on page 71. Okay, so say that I have a nerve stuck in between the bones in my elbow. Where would I find anesthesia for that? What's it going to be under?
Arm and elbow.
Upper arm and elbow. Okay, I had a gastric sleeve done. Say that I got an infection and I had to have a debridement done, but I needed anesthesia. Where would I get that?
Lower abdomen.
Yeah, the lower abdomen. Okay, so do you guys understand why I like to label these sections? Because if I have something for the lower leg, I can just open it and I'm on lower leg. If I have something for the wrist, I can just open it right there to the wrist. Anesthesia is one of the few, anesthesia and A&M are one of the few that you can really do that with. I mean, there might be a couple of others where it's easy to do it this way, but if I can bypass that index and know where I'm going and feel confident, I want to do it. You do not have to do it that way, but just for me. So where do you think that you would find anesthesia in your index? Under anesthesia. It's just listed under anesthesia, and there's just 3 pages of it, and then you just look for your Anatomic site, because anesthesia is broken up into anatomic sites, right?
Mhm.
Okay, so you guys are not going to have any trouble with anesthesia. If you're new to coding, this is a great place to start because it just lets you dip your toe in and it's not complicated. I'm going to say again to the, because some of you ladies weren't here when I said it, when you're reading your chapter and you get to the anesthesia formula, I do not want you to get stressed out if you are not great at that. You're never going to see it again unless you become an anesthesia coder, and then that facility will train you the way they want that done. I think you just have one exercise where you're going to be figuring things up, but I don't want you to stress out about not knowing that formula inside out, backwards, and whatever. It will not be on your NCCT certification exam, and it will not be on your chapter test, and it will not be on your final test. The only time that you're going to see it is when you're doing your exercises. Okay, any questions about anesthesia before I move on to our next exercise? Okay, so do you guys remember when we did abstracting before? Oh, wait a minute, I have to take, y'all bear with me with the jiggles. I'm gonna take this off and put it on my computer where it goes. Here we go. Oh, now we're regular and normal. Do you guys remember what abstracting is? Abstracting is taking a medical record and pulling out what information you need to be able to code. Never used the word abstracting when I was coding, but who knows what you will or won't have to do, or what phrases will be used in your facilities. So I actually have excuse me, I have us a little abstracting exercise to do together. There's actually 6 problems. Let's move through them fairly, I'm not real quickly, but you know, let's not overthink this. Everything you need to know is in the scenarios I'm about to present. So I'm going to share my screen. Can you see this?
Yes, ma'am.
Okay, so we're going to do number 1. Of course, I can't get it just perfect. So it's outpatient hospital. The gender is male. His age is 67 and his status is P1. So what is P1? P1 is a normal, healthy patient. The time that the anesthesiologist started was 9 o'clock. Stop time was 11:15. The anesthesia provider was a CRNA without medical direction. Anesthesia type. Patient requested general anesthesia rather than conscious sedation because he was anxious about remaining awake for the procedure. The diagnosis was corneal edema that is a sequela of an automobile accident 5 years ago. Sequela means a condition or a new diagnosis that was caused by something that happened in the past. Don't worry about it right now, but I know that's a weird word and I just wanted to tell you what it meant. Procedure is a corneal transplant, right eye. Okay, so let's look at what A is asking us. What is the anatomic site and type of procedure for the main procedure performed?
Eye, and it's a transplant, corneal transplant.
Yes, but also it could also be right cornea because of the corneal transplant. They're working specifically on the cornea of the right eye. Make sense?
Yeah.
Okay. What is the diagnosis?
Corneal edema.
Yes, corneal edema. Okay. Miss Rhonda, this one's yours. C, how old is the patient?
67.
67. Number on D, it says, what type of anesthesia is provided? Miss Kelly, was it local, regional, or general?
Local? No,
Okay, look under anesthesia type.
general. Sorry, general.
Yes, that's fine. You're good. General. Okay. E is how long was anesthesia care provided? Jada, how long was this care provided?
2 hours and 15 minutes.
Yes, ma'am. Okay, Erin, the next one's yours. What is the health status of the patient? Remember, it's that letter and number.
So P1, that would be normal health, normal healthy patient.
That's right. Okay, what type of anesthesia provider is in attendance? Loriana.
CRNA
Yep, without medical direction.
without direction.
Guess what you just did? You abstracted a medical record. Does it get a little more complicated? Yeah, it does. But if you just start small and build, remember the first time you guys had to do an abstracting exercise, do you know I had 20 calls? What are you talking about? I don't know what this is. Are you crazy? I can't do this. But now I told you, we're going to get back around to it because I think it's so important for learning to pick out those key things that you're going to need in a medical record. Okay, y'all, I just want to give y'all a warning. I keep getting a thing that pops up that says my internet is unstable and I don't know why. But we're going to go ahead and move on to the second one. All right. So I'm going to let y'all read it and then we're going to just answer the questions. Miss Roblin, you got A. Miss Rhonda, you got B. Miss Jada, you got C. Erin, you got D. Antoinette, you got E. So what is the anatomic site, type of procedure, and approach for the main procedure performed?
This is a kidney transplant, huh?
Yep, a kidney transplant. What is the approach? It's a kidney transplant with an open approach. It's okay. It doesn't give you the whole thing. Okay, guys, somebody's music is playing. Can we mute? Thank you. Okay, who did I give B? What is the diagnosis?
ESRD. I don't know what that means, but
End stage renal disease.
okay.
Okay, C, how old is the patient?
28.
28. D, what type of anesthesia is provided?
General.
Okay, E, how long was anesthesia care provided?
3 hours and 30 minutes.
30 minutes. 3.5 hours.
3 hours and 30 minutes. Okay, and we have more up here, so let's go up here.
The health
Sonia, you do this one. What is the health status of the patient? And I'm gonna move back down.
E4, a patient with severe somatic disease that is a constant threat to life.
End-stage renal disease is a constant threat to life. So that's good. All right. Lariana G, what type of anesthesia provider is in attendance?
MD, in personal attendance.
Yes, ma'am. Are anesthesia services provided personally by the anesthesiologist? Oh, goodness. Miss Rhonda.
Yes.
Did the
It was
Oh.
provided by the,
are anesthesia services provided personally by the anesthesiologist?
it was provided, yes.
Yes. Okay, and how many anesthesia providers did the physician supervise, if any? Jada?
None.
None. Making sense?
Mhm.
Okay, we're going to do one more together. And I'm not going to load these and have them as an extra assignment. I will put this video into our daily assignment for today, but I just wanted y'all to get more comfortable with seeing these abstracting exercises. I think they're so important. Okay. So let's do number 3. Miss Kelly, you have A. Antoinette, you have B. Erin, you have C. Miss Rhonda, you have D. Miss Roblin, you have E. Lariana, you have F. Oh, who? Let me see. Who didn't get one? Oh, okay. Sorry, y'all. It's hard to remember. Okay. Oh. Sonia, you have G, and Jada, you have H. Okay, what is the anatomic site, type of procedure, and approach for the main procedure performed?
The prostate,
Yes, it's the prostate, and what was the approach?
a resection, transurethral resection.
Yeah, yes, that approach. So I want you guys to look at TURP, transurethral resection of the prostate. That is a acronym that you're going to see regularly. I would suggest just making a note of it. Okay, who has what is the diagnosis?
I really can't say. I know is it BPH?
Benign prostatic hyperplasia. Come on now. It's right there. It is BPH, yes. Okay, how old is the patient?
He is 66.
Okay, what type of anesthesia is provided?
Is it general? General?
General?
No, local.
No, it's general.
So I can't hardly see this. Okay.
I thought it was spinal.
Oh, hang on a minute. It is spinal. Y'all, where am I at? I was looking at something else.
What type?
This answer key's wrong. It's spinal.
Okay.
Okay, what is the health status of the patient? Oh, wait a minute. How long was the anesthesia care provided?
I can't see it. My screen.
11, 12.
So what does?
It's 1 hour and 45 minutes.
Okay, because I couldn't see it. I know it was 1 hour and something.
Yeah, I'm
I
sorry. I
couldn't.
wish I could make it clearer, but this is as good
I
as
know
it
it's.
is. Okay, what is the health status of the patient?
P1, a normal healthy patient.
Great. What type of anesthesia provider is in attendance?
CRNA under medical direction of an anesthesiologist.
Great. Are anesthesia services provided personally by the anesthesiologist?
No.
Nope, they're not. Okay, do y'all feel good about this, or do you want to do more? Miss Roblin, you're shaking your head, but I don't know which one you're saying yes to.
Oh yeah, they seem simple.
So y'all want to do one more? Okay, we'll do one more then. Okay. Oh, darn it. It goes to another
Page.
Okay, y'all write down what you need to know. I'll go slow. Outpatient, gender male, age 78, status P3, starting time 13:15 to 1500, anesthesia provider, CRNA without medical direction, type of anesthesia is general, diagnosis is cardiac arrhythmia, procedure is pacemaker insertion. Okay, did y'all get all of the other one?
I did
Ma'am.
not. Okay, wait. Without medical direction.
Okay, you ready? Okay, Erin, what is the anatomic site, type of procedure, and approach for the main procedure performed?
Would it be the heart? And then the procedure is, okay, so the anatomical location would be the heart.
Mm-hmm.
Okay. Procedures pacemaker, cardiac pacemaker inserted. And then what other part? What is I missing?
That was it. That's all we
Oh,
needed.
okay.
Great.
Mm-hmm.
What is the diagnosis,
Oh.
Antoinette?
Cardiac, well, I don't know how to pronounce it. What is it?
Arrhythmia. Okay. Miss Kelly, how old is the patient?
78.
So what, will we need an add-on code for this?
Yes, ma'am.
Yeah.
Because he's of extreme age, so we would have to use our add-on code 99100. Yay! Woohoo! Great job. Okay. What type of anesthesia is provided? Local, regional, general? Miss Rhonda.
General.
Very nice. Okay, how long was anesthesia care provided, Jada? I know, why do I keep doing this to you?
Hour and 45 minutes.
Yes, ma'am. Okay, Lariana, what is the health status of the patient?
P3.
And what does that mean?
A patient with severe systemic
Systemic disease.
disease.
Yes. All right, and what type of anesthesia provider is in attendance? Abby, what type of anesthesia provider is in attendance? Okay, somebody else answer.
CRNA without supervision
Medical direction.
or medical direction, I mean.
Oh, well, Abby was here, but I don't know where she went. Sorry. I'm gonna have to start writing down who's here, because when I start, like, I'm on the spot going, who gets this one? Who gets that one? Who gets this one? Who did I call before? I can't remember. All right, so are we feeling good about anesthesia?
Mhm.
Okay, I know it's a lot to remember, because
Yes, ma'am.
we have to decide if we need a special modifier, and then we have to remember if we need a qualifying circumstance. So you're going to get practice in that today. Remember, you can use your answer keys to make sure that you have your answers right if you would like to. Or you can call one another. You can call me, however you need to do it. But we will be coding anesthesia on Thursday at 11.
Okay.
Any questions right now?